Hi, thank you everyone for joining. Welcome to our sleep wellness presentation. I know this week my sleep has been a little bit funky with the time change. I also have periodic bouts of insomnia where I feel like I'm up all night. So I'm definitely looking forward to hearing some of the tips from Pam today. I'm Jessica Cochran. I'm the Director of Community Relations for Alaska Behavioral Health. For those who aren't familiar with us, I'll just share a little bit. Alaska Behavioral Health provides outpatient mental health services to Alaskans across the state. We have clinics in Anchorage and Fairbanks, but we also do serve statewide through telehealth and serve a lot of clients in those locations through telehealth right now. We serve children and families, children starting as young as age 2 or 3, and then on up through the span of life. And our clients have a wide range of mental health concerns, from anxiety and depression to serious mental illness. We provide individual and group therapy, psychiatric care, including medication management, skill development, vocational services. We now have primary care available for clients who don't have access to primary care elsewhere. And I said outpatient, but we do also have intensive support services, including residential treatment services for adults who need a higher level of support. Before I introduce our presenter, I'll go over a few housekeeping items. We are recording today's presentation and we are also on Facebook Live. That's what took me a couple minutes there. But don't worry, we're in webinar mode, so your name and video and microphones will not be showing up in any of those places. That also means that to ask questions, you'll need to use the chat box or the Q&A box, as opposed to just turning on your mic and asking a question. But we do really want to encourage you to ask questions, so please do jump in there and we will pose those questions to Pam after her presentation. All right, so I'll introduce our presenter. Pamela Kennedy is a licensed professional counselor, or LPC. She's worked at Alaska Behavioral Health for, I'm pretty sure, more than 16 years now, in various positions, from providing direct clinical care to working on process improvement. She's very passionate about the work she does to improve the care, quality of services, and client experiences here as our Chief Client Experience Officer. As a clinician, her focus is on providing person-centered, goal-directed, trauma-informed behavioral health interventions using cognitive behavioral therapy, dialectical behavioral therapy techniques, and sensory integration techniques. And perhaps most important for today, she has led several groups for clients at Alaska Behavioral Health to address insomnia and other sleep issues. So with that, I will turn it over to Pam.
Great. Thank you so much, Jessica, and welcome everybody. I'm so glad to be able to be here today and present some information for you. So there's a tremendous amount of information out on the net with regards to sleep wellness. My focus for today was to try and bring it down to a manageable chunk and for things that you can actually do to improve your sleep. So I want to give you a little bit of information about sleep, ongoing challenges, which is not unique to necessarily the pandemic, but has been a longstanding issue for the nation. And so I have some information for you around that. We'll talk a little bit about the phases of sleep, which you may or may not be as familiar with, as well as the benefits of each of those phases of sleep. Talk about briefly the impact of poor sleep on mental health for pre-existing mental health issues as well as emerging mental health issues. The physical risks associated with poor sleep, as well as diet and fitness considerations that can help improve your sleep. Sleep hygiene tools and tips. Hopefully that's the piece that you'll be able to take away and work to make some changes in. And then ways to reduce your anxiety and stress, as well as smartphone applications. Again, which there are a ton out there. Okay, so just kind of in brief, talking about ongoing challenges. So certainly with the pandemic over this last year plus, it's been a significant disruption to our daily life. You know, the social distancing is something that is not has not been a common thing that we've had to do prior to the pandemic. Being stuck at home, and not just being at home, but being stuck and not being able to, or not being feeling safe, being able to go out. Working from home, not everybody has an environment where they can work comfortably from home. Anxiety and worry associated with the pandemic, depression and isolation, resulting from isolation from our community, family members, and increased screen time. So screen time means on your smartphone, means on gaming consoles, computers, that sort of a thing, and stress-related fatigue. So all of these are ongoing challenges in our lives that contribute to our challenges related to sleep. Recommended hours of sleep by age. So I pulled this, and this is from the CDC, and you'll see this graphic. At the top here is where our adults and older adults are moving down through the adolescence, which actually 10 hours is recommended on average for an adolescent per night to get that much sleep. And then as we go down, you'll see this is more for infants and newborns. This is what is recommended as sleep. So I thought that was interesting. This next graphic, just to kind of give you an idea of the prevalence of short sleep duration. So this is less than 7 hours of sleep per night for adults aged greater than 18 years old. And this is actually from 2014. And you'll see, the darker areas represent a higher percentage of short sleep that adults had reported. There hasn't been, that was the most recent poll that I could find. However, there was a poll in 2018, 2019, again, prior to the pandemic, that showed adults were actually getting on average 5.5 hours of sleep, almost 3 hours less than what is recommended by the CDC for, healthful sleep patterns. I did see information, online that talked about, during the pandemic, that 5.5 hours was actually thought to have reduced even more to 5 hours or less than 5 hours of sleep per night on average. So you see, it really is a crisis. It is a significant impact on everybody's life. We'll talk a little bit as we go along about the impact of having that lack of sleep. So what is sleep? So sleep is part our circadian rhythm, which you may have heard of before, which is our body's internal biological clock. And then sleep is also part of the sleep-wake homeostasis. This is what your body keeps track of, the amount of sleep that you need. And when these are altered, so our circadian rhythm is altered, as Jessica had mentioned with the daylight savings, that impacts, right? When we go to sleep, when we wake up, it throws our sleep off a little bit. Let's see. When it's really impacted, when we have many nights of sleepless nights, it can really impact the 4 stages of sleep. And our bodies require these 4 stages of sleep, or phases of sleep. And those are wake. So every night we have wakeful periods, light sleep, which is our greatest portion of time spent in this phase, deep sleep, and REM sleep. And then these 4 phases are actually repeated 4 to 6 times a night. And when that's disrupted, then we're not getting the benefits out of each of those phases, which we'll talk about on the next slide. Sleep cycles earlier in the night tend to have more deep sleep phases, and then later cycles tend to have more REM. And REM is where we have our dreams and things along those lines. So here we talk a little bit about benefits of sleep. If you needed to be convinced on getting some good sleep, here's the benefits. So during the first phase, the waking or dozing off stage, you notice that your body is breathing more slowly, your brain activities are slowing down at that time. There may be brief periods of movement or twitching, that might startle you awake a little bit, but then, you fall back into that kind of wakeful or dozing off stage. If we think a little bit about mental health issues related to kind of going to sleep, during this particular phase, if you have to-do lists or other worries or things that are continuing to race through your mind, it makes it hard for this first part of sleep in order for you to kind of move into the next stage of sleep. So we'll talk about that a little bit later on how to improve that. The next phase is light sleep, and you notice that your muscles are relaxed, a decrease in your body temperature that might not be so noticeable for all of us, and then respiration and heart rate. So then that pulls us into our deep sleep, where the benefits of that are muscle and tissue and cell growth and repair. So this is a really, really critical piece of our sleep process. And if we don't get that, then our body is not as efficient as being able to do this. And the fourth phase is the REM sleep. And during that time, we have our vivid dreams, our temperature regulation is shut off, our body is immobile so that we're not acting out our dreams. But the benefits of that particular phase are for our memory, our learning, our problem solving. So these are all required phases of sleep in order for us to, receive those benefits and then be awake and active during our wake cycle. So during this time, during the deep sleep time, it actually improves our immune system as well. So we talk a little bit about the pandemic and just, about health in general, flus and colds and stuff like that. If we're not getting our deep sleep, there's a research article, it's a scientific research article, but it talks about how our immune system is impacted without deep sleep. And the cytokines that are released during that time, are not able to do that. So then our immune system is weaker and we're not able to, fight off the bugs that we encounter. Okay, so impact of poor sleep on mental health. So many of us may relate to this little minion here who has shared with us that at the moment when you're tired and sleepy and you go to bed and your body's like, haha, just kidding. I can definitely relate to that as well. You lay in bed and your mind starts racing. And, insomnia is certainly very cyclical in nature. And so we're going to explore ways to kind of disrupt that cyclical nature and get ourselves back on track. All right, so your mental health is impacted by not enough sleep. So insomnia, just a quick definition there, is individuals who have trouble falling asleep, staying asleep, waking too early in the morning, or waking up not feeling refreshed. And sleep disorders are characterized by abnormal sleep patterns that interfere with physical, mental, and emotional functioning. So this is, not necessarily just a single or a couple sleepless nights and you are considered an insomniac or you have that, a clinical diagnosis of a sleep disorder, but it is something where it impacts the, your daily living and it causes distress. Individuals who struggle with anxiety may have more difficulty with sleep, typically characterized by, racing thoughts and, the anxiousness that accompanies that. So it definitely increases the challenges related to getting a restful sleep. So this is individuals with anxiety disorders, depression, bipolar disorder, and even PTSD, post-traumatic stress disorder. When we worry, as you may know, our minds are busy and do not allow us to relax. So in that the second phase, first couple phases of sleep, if our minds are spinning, we're not allowing ourselves to move into that phase. So for individuals who have a pre-existing condition, in particular with post-traumatic stress disorder or traumatic, having experienced traumatic events, they have an activation in their brain, in their amygdala. So that's part of the brain that manages sort of the fight or flight. I see that there's looks like three chats. So I'll take a look at those here in just a second okay, there's a lot of chats. Let me finish this slide and then I'll look at those. So individuals with post-traumatic stress disorder have their, amygdalas activated and may be very hypervigilant, very aware of, the information, or not the information, but the sounds that are around them, and wake. So in the middle of their cycle, or not being able to get into that deep sleep cycle, and it really is highly impactful. Let me take a look at, okay. Awesome. All righty. So there's that. All right. So the physical health risks. So not only are there mental health, risks or impacts related to not getting enough sleep, but then there's also the physical risks. And there are common, actual physical sleep disorders, including sleep apnea, sleepwalking, narcolepsy, restless leg syndrome, and then also grinding of your teeth while sleeping. These are all things, if you're experiencing any of these things, you definitely want to, get in contact with your doctor, because there are treatments that are available that can then help manage those. When you're experiencing a sleep disorder, the risks are, actually developing an anxiety or mood disorder, heart disease, heart failure, irregular heartbeat, heart attack, high blood pressure, stroke, diabetes, and obesity. So these, it's not, again, just a one-time, but this is longitudinal. This is over a long period of time with, having difficulty sleeping and the disruption in your sleep cycle. You're at greater risk for developing some of these items. There's a lot of things that kind of go into that. So it's not just sleep, but it is, one of the things that can impact that. And just, to kind of say again that, the risks of inadequate sleep extend way beyond just being tired. Sleeplessness can lead to poor performance at school or work, increased risk of injury because you're not focusing or able to focus or pay attention to what it is that you're doing. We talked a little bit about the health problems associated with that. Huge impact on your mood. If there are difficult things that are happening or challenging interactions that are occurring, it's more difficult to be able to regulate your mood and engage with somebody with a conflict in a way maybe that's more rational if you're not well rested. If you are well rested, you can engage and resolve the issues, maybe with greater ease. Couple of things, so you may have heard of this as well, diet considerations. So a poor diet or lack of physical activity can cause people to have difficulty staying asleep and falling asleep. So in particular, big culprits are chocolate, and not necessarily just a bite of chocolate, but maybe a chocolate bar. It's the sugar and the caffeine that are stimulants within that, and then coffee. So for individuals, coffee within several hours, like 6 to 8 hours before you're going to sleep again, really can disrupt your body, and then, impact middle of the night waking, or even just ability to go to sleep right off. For some individuals, heartburn inducing foods, as well as swallowing, is reduced during since swallowing is reduced during sleep. If you have eaten heartburn inducing foods, so high fats or greasy foods is what I'm trying to say, or spicy foods, that can really sort of impact that. And if your body is uncomfortable, then you're gonna wake yourself up, again, disrupting that, 4 to 6 cycles of those sleep stages that you need to go through. Okay, so here are some helpful things that you can do. Let's talk about that to improve your sleep. So sleep hygiene behaviors. You may have heard this too, exercising at least 30 minutes a day can help you stay asleep. So exercising, as you know, it releases endorphins, but it also releases serotonin, and serotonin helps to regulate your body's sleep cycle. Yoga is also another highly beneficial exercise that can support your body, not only in staying fit, but then being able to reduce stress, reduce anxiety, helps with breathing. And then also, since it's exercise, you're releasing some of that serotonin as well. So you also have to think about sort of your day, and exercising within about 2 hours of your bedtime, it activates your cardiovascular system, which is good, but if you're getting ready to go to bed, that isn't something that you want to do. You want to kind of have those calming, quieter activities at least a couple hours prior to bedtime, if at all possible. So exercising earlier in the day is certainly the most ideal. So keeping in mind that even small changes can boost your chances of a good night's sleep, and minimizing middle of the night waking, or minimizing the amount of time that you're tossing and turning, or frustration with going to sleep. We talked already a little bit about caffeine. Alcoholic beverages also before bedtime are things that are highly encouraged to be avoided. Creating a bedtime routine. That routine, since we're behavioral creatures, that routine helps us to sort of get in the mindset of, okay, now it's time for us to go to bed. And that could be, taking a warm shower, taking a bath, drinking a cup of tea, some quiet sort of down regulation activities that can really help with that. So naps for adults and even adolescents, as you're growing and wanting to, if you have to take a nap as early kind of in the day as possible. Again, thinking about that sleep-wake rhythm that we have, and wanting to, kind of maintain that. And if you sleep during the day, then it impacts your ability to be able to go to sleep at night. It disrupts that cycle. Another tip that you could always try, and it doesn't mean you have to try everything on this list in particular, but trying a couple of them and see how it works over a couple of weeks, a month period of time. Keeping your bedroom cool and dark. A little bit more challenging as we're going into spring and summer here in Alaska. But it certainly is something to consider, and see what you can do to help with that. Setting a schedule for the time to go to bed and wake up. So the recommendation here is actually where you're setting a schedule 7 days a week. That means not sleeping in on the weekends, because it actually disrupts your sleep-wake cycle. So if you're having a difficult time sleeping, one thing to try over a period of a month is to get up at the same time every morning, 7 days a week, and go to bed the same time each night during that month. And it will help to, reset your circadian rhythm and your sleep wake cycle. And here, I think I'm going to talk a little bit about this establishing a plan when you can't stay asleep during the night. So I'll kind of pause on that and go on to the next piece. So you want to associate your bed with sleep. So when I do groups, this is a big point of discussion that we have. And individuals who struggle with sleep typically have their bed or their bedroom associated with something else. We think about the pandemic, right? And like I had mentioned early on in the slides, that maybe some of us are working from home and you don't have a space to work. And so you're working in your bedroom to have some measure maybe of privacy, but you're in your bed, you're working, and you're associating your bed with work. So that's a real kind of a salient example right now. So asking these questions, what thoughts, if you're laying in bed and, what are the things that have led to the problematic pairing of bed versus awake for you? And, what are the thoughts that you have as you lay awake? Say you have your to-do list that is running through your head. Those might be, I didn't get this done, or I need to get this done. How does that make you feel? I can imagine anxiety and frustration and, just being tired of being awake and wanting to go to sleep, and then that frustration around that. And then how does it make it easier or harder to fall asleep? So it would make it more difficult to fall asleep if you have those thoughts and those feelings that are running through your mind. Another good question to kind of ask yourself, how do you know when you're sleeping? How is this different from being physically tired? If we think about being mentally tired, but our body is active and it's time to go to bed, we could recommend progressive relaxation, so that, if your mind is tired, but your body's busy, and you start from your head and you move down to your toes, squeezing and releasing each major muscle group. And then, continuing to repeat that. So you're expending that energy that your body maybe is continuing to hold, and allowing your brain to go ahead and start that sleep cycle process. In the, reverse, if you have, maybe a really tired body, maybe you went on a long hike, or you had a physically difficult day at work, or, really exercised hard, but your brain is really busy. So a different strategy would be maybe a visualization, which I'll talk a little bit about later. And, while your body is relaxing already, you're helping your mind to relax and go into that sleep cycle. So we talked a little bit about waking up at regular times, regardless of how well or how long you slept. So an option here is that, you are forcing your body to get into that sleep-wake cycle. And then, again, avoiding or reducing naps, and making sure if you do nap that it's earlier in the day. Additional considerations to improve sleep: only use your bed for sleep or sex. For example, if you have in your room, you have a TV and you fall asleep to TV, then, your bed is being associated with TV watching. It's not being associated with going to sleep. So that's something, that I know is a kind of a common thing to do that. And it's stimulating. TV can be very stimulating. Before going to sleep, you want that down regulation, that quieter activities. To reduce frustration, when you are in bed and you're having difficulty falling asleep, after about 15 minutes, go ahead and get up. Don't stay in bed and, toss and turn and toss and turn, because then again, you're associating the bed with tossing and turning and being awake rather than going to sleep. Remove yourself. It could even be in the same room. I know if you have a partner, you obviously need to be considerate of that particular individual. But if you want to stay in a quiet, low stimulation environment, a dark environment, so maybe there's a chair in your room or another room in, where you live that you can sit and listen to quiet music, maybe pop your earbuds in if you have them, or just listen to it on a real low level, or reading a book, really low light, and not a high adventure book, right? That's another stimulation. You want to have kind of that relaxing environment that you're presenting to yourself. And then when you start to feel tired, then go back to your bed and try that again. Don't check your cell phone or email or watch television or get on the computer, and even it says here, or don't read. Again, I think you just kind of have to figure out what certainly works for you. The goal here is to really reduce that stimulation and make it calming and relaxing. Another thing that you can do is hide your clock. If you have a clock on your nightstand next to you, turn it away, so that it's not kind of blaring at you. Some of the frustration cycle that occurs is you're laying in bed, you're trying to sleep, you're looking at the clock. Oh, it's only been 2 minutes. I need to go to sleep. You try to go to sleep, you look at the clock. Oh, it's only been 5 more minutes. And then that just kind of really starts that whole anxiety and frustration cycle going. So reduce that clock access, visual access, if you can. All righty. So here are some other things that we can absolutely do, some kind of really hopefully clear actions that you can take. So I started to talk a little bit about meditation. So to reduce anxiety and stress, which also then will help to promote that sleep process, meditate. There's lots of guided meditation apps that are out there that you can do, that are just you're listening to, that can guide you through that. That's great. A lot of times what I recommend or encourage people to start with is focusing on your breath. So breathing in and out slowly and deeply. If we think about, most of us really kind of breathe from our, our upper part of our lungs. So when I say to breathe deeply, if you gently place your hands on your lower abdomen and you take a deep breath in, you're feeling the lower part of your lungs. When you feel your hands kind of gently move, your lower abdomen just move out a little bit. So breathing slowly and deeply at a regular pace, and it should feel relaxing. It shouldn't feel anxiety inducing. It shouldn't make you feel lightheaded. If you're feeling lightheaded, then, you kind of need to stop and take a different course, just breathe a little bit differently, just kind of normally. But when you're meditating, taking those slow breaths in and breathing out, you're also visualizing. And like it says here, to visualize a serene environment, such as a deserted beach or a grassy hill. I find that asking people to think about a place where they've physically been, because when you're meditating, then you can wrap in all the senses. So if I've been on a hike, I can focus on the crunch of my shoes on the gravel path. I can focus on, I can visualize, or I can remember the sound of the birds that are, in the trees. I can remember the feel of the breeze on my face. I can remember the feel of the cool air as I was hiking, the smell of the fresh air, and maybe the smell of the water of the little creek that was running by as I was hiking. The smell of the flowers, the smell of the evergreens. So when you're meditating, really kind of making it as personal as possible can really make it impactful. So we talked a bit about exercise. Regular exercise is good for your physical and your mental health. It does provide an outlet for frustrations and releases those mood-enhancing endorphins and the serotonin. Prioritize your to-do list. So this is like during the day, you're feeling, anxious and stressed about what it is that you're doing. Jot it down on a piece of paper or on your phone if you're kind of more electronically focused. And, and prioritize. And if there's things that can be delegated, then definitely do that. Make it more easily managed. I like to bring this back to like when you're in bed, if you're tossing and turning and you have that to-do list that's spinning through your head, have a piece of paper next to your bedside table and a pencil or pen and just jot down a couple of things. It's like, you know what? I can think about that later. Right now, my task is to go to sleep. I'm going to put that down on a piece of paper and it'll be there for me in the morning. To help reduce anxiety and stress, you can listen to soft, calming music. It can lower your blood pressure and it does relax your mind and body. Talking about sleep here, right? So here's the cyclical nature. Get an adequate amount of sleep to reduce your anxiety and stress. But if your anxiety and stress is around not getting enough sleep, that just definitely makes it frustrating and more challenging. Here's an option, certainly directing your stress and anxiety elsewhere. So volunteering or helping, even in your small groups, family group or small community groups, if there are things, that you feel you can do, that is a great way of giving back to your community. And it has been shown to reduce anxiety and stress, being able to give back. And then definitely talk to somebody. You can talk to your doctor, your medical doctor, or even therapists here at Alaska Behavioral Health, or other therapists in the community. That's definitely something that you can do that can be very helpful. So I'm not going to spend a whole lot of time on this piece. This is just a summary that I hope to, you can kind of take with you. Turn off your electronic devices, exercise, meditation, limiting caffeine, limiting or avoiding alcoholic beverages before bed, keeping your bedroom environment cool and dark, setting a schedule, and then establishing a plan when you can't fall asleep or stay asleep. And we talked a little bit about this as far as, when you're tossing and turning, within 15 minutes, get up, go sit in a chair in a dark, calming, quiet area, listening to music, meditating, breathing, that sort of a thing. And it takes persistence and consistency. It's helpful when you're making any behavioral change to have somebody do it with you. So not that you're communicating with them in the middle of the night, but somebody that then you can talk to, a friend. It's like, oh yeah, this is what worked for me. This is what was difficult, and at least you have some kind of camaraderie in that overall process. But you got to stick with it for a good month to really see the benefits. I'm not going to read all of this, but again, this was from Sleep Foundation that I found, and they had several that they recommended. I just pulled these 3 out because they were both for iPhone and Android. They were free cost, with the exception of this one that has the premium version, which I don't know, exactly what the premium version is. I liked this one because it, through biometrics, it tracks your sleep cycle. And it will wake you. So you set your alarm for kind of a range of time, like 7 to 7:45, and it will wake you during your light sleep cycle, rather than your alarm just goes off at 7:45, and maybe you happen to be in a deep sleep cycle. So then you're going to wake up groggy and tired, right? Because it's not the phase that you want to be awake in. or a REM cycle even. So anyway, so that was, I thought, interesting. We talked a little bit about individuals who, maybe have experienced traumatic events, or, experience PTSD, and with the, the high activation, sometimes having sleep sounds or white noise can help to reduce just the overall sounds of the living environment, so as not to startle somebody awake. So that may be something that to consider. But like I said, there's a whole ton of stuff out there, and you do need to just kind of experiment and figure out what works for you. Oh, that's our sleep mood. All right, so I think that was that piece. And that is kind of my summary and just a brief introduction. Just wanted to really kind of, I guess, impart some hope that there, it is possible to impact your sleep cycle, using some of the techniques, being persistent and consistent with that process. And yeah, you can really can make a difference. And if you need to, here's our number, Alaska Behavioral Health. We do have clinicians available, so please don't hesitate to reach out if you want to talk to somebody, need to talk to somebody, and we can definitely help.
Thank you, Pam. And yeah, please do, if you have any specific questions, add those into the chat or the Q&A box, and we'll take a couple minutes to answer those. I had one, which I'm not sure if you saw, Pam, but I read in bed. I don't watch TV in bed. I try not to phone in bed too much, but I do read books. Is that problematic?
I don't think so. I mean, that one of the recommendations is, not to read in bed. But I think that if, I do think that it's individualized per person. And if you're not reading like a really active, high intensity book, maybe you save that book for middle of the day or the weekends or something. And then, a book that you're reading at night is, something that is not quite as stimulating.
Okay, thank you. I love the idea of the alarm clock that knows the right phase of sleep to wake you up. That's great.
That's something.
Yeah. Anyone else have questions out there? All right, I'm not seeing anything. I will just pop our website into the chat there too, if anyone wants to find us that way. And I'm also going to put my email address in there if anyone wants the slide presentation or a direct copy of the recording. Please feel free to email me for that. We will get this up on our YouTube channel and webpage within a couple of days here too. And it should be up on Facebook for a little while as well. So thank you so much for coming, everyone. Really appreciate it. And thank you so much, Pam. That was really helpful.
Yeah, I'm so glad. Thanks, everybody.
Bye.